Good morning. Huinga NURR'araalukDavidson, amellamakanaanlu yupiugua mamtaqiillaqamiu, aanaka kuigilaqamiuq, ataka kassauq, Port Orchard, Washington aqmiuq. My Yupik names are NURR'araalukDavidson and amellamaknaan, and my English name is Valerie Davidson. My mother's family is from Guigilok, which is literally means village with no river because it's located on the ocean. In our region, which is the size of the state of Oregon, with 58 federally recognized tribes, there are no roads connecting any communities. So all of our travel occurs on the river, in the summer by boat, in the winter it freezes and we're able to drive on it, and also by airplane. My mother's home village, Guigilok, has about, we consider it to be one of the larger villages because it has about 379 people. And so in Alaska, our average village size is about 300 to 350 people. So I want to say, Qoyana Ugotin, Michael Bird, Qoyana, thank you to Michael Bird for the invitation to be able to speak with you today. And I want to first acknowledge that I'm speaking today from Anchorage in Alaska, a very urban center. We consider it a giant city. I want to acknowledge the Dena'ina people upon whose land that we have the opportunity to live, to play, and to work. So I wanted to share a tribal health perspective and the notion of nothing about us without us. I'll come back to that in a little bit. So Alaska Pacific University is a private university that was established by Peter Gordon Gould in 1959. He was an Unangach man, or also known as Aleut. And our vision is really honoring our Indigenous heritage, exemplifying excellence, and preparing paths. We're a member of the University of the Arctic, and we also enjoy a strategic affiliation with the Alaska Native Tribal Health Consortium, which is a statewide tribal health organization providing services to all 229 federally recognized tribes in Alaska, and provides services that used to be provided by the federal government through the Indian Health Service. That strategic affiliation allows us to be able to focus on tribally driven and culturally responsive research and support Indigenous researchers and scholars, and also work on rural workforce issues. So we have a number of supporting partnerships. I mentioned tribes in the first instance. Not only are 229 federally recognized tribes in Alaska, but also the other tribes in the United States, which total 574 federally recognized tribes, including that. I did want to mention one thing that's really important to remember is it's so easy to get lost in the statistics and lost in the numbers. And I just want to emphasize, and sometimes we focus on our differences, but we also need to focus on our commonalities. And the truth is, Alaska Native people and American Indian people want what every other American family wants. We want our children to be healthy, we want them to be happy, we want them to live in safe communities, and we want them to be well educated. But because of where we live, we may have to do things differently in order to accomplish that. So that requires a number of different partners that you see here on the screen. I want to give a special shout out to Dr. Jay Butler at the CDC. He's the Deputy Director for Infectious Disease. I've worked with him for about 20 years. If any of you have the opportunity to meet him, you should definitely seek him out. Nationally in our country, most of the healthcare has been provided through the authorization of the Indian Health Service to about 2.6 million people. And the care is provided in one of three ways. Direct service, where the ATHS is providing that service directly, often in the Midwest states. Urban Indian health clinics in some large metropolitan centers or cities, which were created because of the education opportunities and people basically got stuck in large cities. And the third are tribally compacted services. You might hear my dog in the background. I must say he's not a sled dog, which wouldn't give me any street cred in my community. He's a fluffy white dog that doesn't know how to pull a sled. All he knows how to do is be cute and live in the house. So the tribal health system in Alaska is really a voluntary affiliation of tribes and tribal organizations who provide health services to Alaska Native American Indian people. Collectively, we have about 12,000 employees. Just to give you a sense of scale, the Alaska Department of Health and Social Services, which is where I used to work, has about 3,500 employees. So we are much larger than the state. And we are, for all practical purposes, the public health system of Alaska, because we have presence in every single community. Every tribal organization is autonomous and serves a geographic area. And just to give you a sense of the size, you can see the overlay of Alaska in what my mother still calls the United States of America. And we provide a 4-tier healthcare delivery system that includes everything from, you can see in this region that I'm from, an area the size of the state of Oregon, 75,000 square miles, 58 federally recognized tribes, no roads between any communities is this region here. And we have about 200 clinics in rural Alaska. There is a regional hospital that is located in each of these spots here you can see. And then eventually for care that's needed to be provided for tertiary care, folks will be sent into Anchorage by plane because you can't drive to Anchorage, which is which was for a long time Alaska's only level 2 trauma center, and which was the highest level of trauma center in Alaska until recently, when Providence also became a level 2 trauma center. So one of the things I should say also is that that one of the reasons that Alaska and so many tribes across the country really move toward tribal self-governance is it really recognizes local control, because no matter how well you do it, when you're providing services and you are directing that activity from Anchorage or from Washington, D.C., you're not on the ground. You're not able to see what the emerging needs of the community are to be able to make those kind of agile decisions. The Alaska Tribal Health System is also governed by the Alaska Tribal Health Compact, which is one compact that has 26 co-signers to the compact, and we negotiate that annually with the Secretary of Health and Human Services. So some of our public health challenges, you can see this information is available on other websites. I'm not going to go into a lot of detail. Just so you know, the health status of American Indian Alaska Native people nationally, is much worse than it is for the U.S. all races. And you can see that's true for both Alaska and nationally. One of the issues I wanted to talk about a little bit, and I'll do that a little bit later, is the impact of the lack of sanitation facilities. There was a study that was done recently by the Alaska Native Tribal Health Consortium and the Centers for Disease Control that looked at infants in communities without adequate sanitation facilities. And in Alaska, 25% of our rural homes don't have running water. We still use honey buckets, which I will tell you, honey buckets have nothing to do with honey. It is basically a toilet seat on top of a 5-gallon bucket. That's how we use the restroom. And the lack of sanitation facilities really create incredible public health challenges. Infants in communities without adequate sanitation facilities in the Bethel area, which is where I'm from, are 11 times more likely to be hospitalized for respiratory infections and 5 times more likely to be hospitalized for skin infections. And those aren't just babies who are sick enough, who are just sick. Those are babies that are sick enough that they have to be medevac to their nearest hospital and hospitalized. And of course, in other parts of the United States of America, you get on the phone and you call 911 and you get an ambulance that comes to your house. In Alaska, we don't have ambulances. In rural communities, there's no 911 doesn't work. You call the health clinic and a plane comes to get you. And if you're lucky, the cost is as low as $50,000 and can be up to $250,000, depending on the service that's needed. And so you can see those dollars really get stretched quite thin. But sometimes we can get lost in the numbers. And I just want to make sure that you understand that infants in those communities, what that means from a practical perspective is 1 out of every 3 babies in those communities will have to be medevaced that year. 1 out of every 3, which is an absolute unacceptable number. So how do we deal with our health issues and how do we get around that? So what has worked for us is when we can provide care as close to home as possible in a culturally appropriate manner and in the language that our communities understand, we have much better health outcomes. And so we have a community health aid program in which it's an Alaska specific provider type that is federally certified by the Indian Health Service. And they receive up to 2 years of training, and they do everything from immunizations for babies, they do prenatal exams, they do a whole host of services. And in fact, in Alaska, if we didn't have the community health aid program, our state would be in deep weeds for not meeting our on-time immunizations of young children. All of my health care that I received as a child until I was about 12 was provided by our community health aide. And she was also the mother of my classmates. And there wasn't anything I could do in that community without Clara Morgan knowing about it. We have also expanded that service into behavioral health aides, which focus on both mental health and substance abuse disorder treatment. We've also started a dental health aid therapy program, which is a mid-level dental program that allows mid-level dental services that have not been allowed before. And for the first time since Contact, we have cavity-free kids. We also have a special diabetes program for Indians. And we also know that one of the biggest impacts that you can make in improving health of a community is in economic improvement. In terms of COVID-19, we've been disproportionately impacted. Our systemic and institutional racism is real. It impacts our health. It impacts access to care. It impacts funding. And really in Alaska, one of the ways that we have been able to really address COVID-19 is through the tribal health system because we are everywhere. And I think I'm a little bit over time, but maybe we can answer some questions a little bit later. And here's my contact information, Brianna.